are quite a few health headlines making the rounds. So, of course, we brought in Dr. Kohli to break them all down for us. Dr. Kohli, I know, Tori, you have your first one.
I do, and we all want to just first say mazel tov to Hillary Swank for the pregnancy. She is twins. She's 48. But I want to ask you about this. Is that safe? How do you feel? I just want to get everyone's take on this as a medical doctor.
Yeah, so I'm very excited for her and her family, obviously, that she's having a pregnancy, having twins. But I have patients who come to me in my clinic all the time and ask me, older patients over the age of 35, which is called advanced maternal age, should I get pregnant? And the risks of pregnancy to mom and to baby are so high after the age of 35. So our eggs that we're born with, they get older and older as we age. And if you're supposed to get pregnant in your teens and 20s, but you're not getting pregnant until your 40s, you have a higher risk of chromosomal abnormalities, birth defects, preterm labor, and then mom has more risks because she's not supposed to carry that pregnancy that late. So is it okay for her to get pregnant? I guess. She needs really close monitoring, and she needs to understand the risks because they're there.
Which I guess she would have because she has those resources.
They'll say you're geriatric like me. Both of my pregnancies were geriatric pregnancies.
We don't say that anymore. It's not considered PC because advanced maternal age.
Okay, I like that better.
Way harsh.
Advanced maternal age. Okay, I like that. Okay, so we reported on this story this week. Katie Couric revealing that she has breast cancer. Dr. Kohli, in her post, Katie talks about having dense breasts, which I do too. A couple of questions on this one. First, how common is that? And next, how would a woman know, and why does it matter?
It's really common. 50% of us can have dense breasts. I'm glad you know, Sam, because Tori here doesn't know, but she's going to get back to us on it when she finds out.
I just know they're great.
They are really good.
They're really good. Sorry, go ahead.
Yeah. So if we have dense breasts, and I'm one of the women that does as well, then our risk for breast cancer goes up because we have more fibroglandular tissue, more breast tissue than someone who has less dense breasts. And it's also harder to detect that on a mammogram because you're looking for a white tumor against a white background. So for women who have dense breasts and their risk is at least intermediate or high, they actually need additional screening like ultrasound or MRI.
Oh my gosh.
So Doc,
get on it, Tori.
Is density important in a man's genitalia? I'm kidding.
That's not about genitalia.
I was going to use a different word, but whatever.
But first of all, before we move
No, let's not.
No, men can get breast cancer.
Yes.
And I want you guys to know that. So 1 out of 100 breast cancers are diagnosed in men. In fact, I had a friend from training. He was a surgeon. He'd been operating all day, started having arm pain, and turned out he had breast cancer, male breast cancer. So jokes aside, men can also get breast cancer for sure. But it's not something you can tell by feeling how dense you are. So it's something you should know.
That joke didn't go the way I wanted, and now we're out of time. I don't even get to ask a question.
Serious fact.
I thought it was funny, but if I could say it the way I want to,
what would you have said?
What do you mean, what would I have said? My bosses are standing right there. I was already thrown in this go.
All right. And your breasts are not part of genitalia, just for the record.
Motion of the ocean?
What? Oh my God. Thank you, Dr. Kohli. We appreciate you. And if you have a question for Dr.
I'm assuming this is her last segment.
Or mine.
Yes.
Your question could be one that we answer on air. We appreciate you. We'll be right back.
Thanks,
Thank you, guys.
I'll take some questions as well.
No, not for him.